Thursday at 10. We don't like to talk about it.
With the stigma of mental illness, we're already beat down.
It's a touchy subject, but more common than you think.
I think that if it was anything but mental illness, we'd be talking about an epidemic.
WBKO's Andrea Walker shares the story of a woman who uses experiences from her tragic past to help others struggling with mental illness.
Warning signs and misconceptions. How you can help a loved one who may be suffering in silence.
Thursday at 10.
When it comes to mental illness, just because you can't see the pain doesn't mean it doesn't exist. It's a touchy subject, so much so that people struggling often feel isolated. But the truth is, they're far from alone.
Vicki Patterson had a nightmare for a childhood.
I was suicidal from the time I was about 11 to 13, somewhere along in that age range, until right at 55.
As a child, Vicki was molested, used in pornography, and raised in an unfit home. The abuse and neglect left her with many unanswered questions.
I knew I was different. I knew it through elementary school, I knew it through junior high, I knew it through high school. I knew it raising my children, but I didn't know what it was. It was like a piece of a puzzle missing.
It wasn't until she was 55 years old that Vicki was diagnosed with borderline personality disorder, PTSD, and depression, the missing piece to her puzzle. Vicki's case, although extreme, is not uncommon. 1 in 4 Americans experiences mental illness. That's 61.5 million people suffering, often in silence.
I think that if it was anything but mental illness, we'd be talking about an epidemic. 1 in 4 people you know is most families. Mom, dad, 2 kids. So someone in that family's life is going to be touched by mental illness.
Mental illness is defined as a wide range of conditions that affect mood, thinking, and behavior.
They may have difficulty getting out of bed, they may have thought distortion, they might have a lot of anxiety about things. A smaller population of individuals will have more chronic mental illness, and for them it could be very significant. It could mean inability to keep a job, it could mean family falling apart, or it even could mean suicide and lead to death.
The following are signs that you or a loved one may want to speak to a medical or mental health professional. Excessive worrying, extreme sadness, problems concentrating, mood changes, avoiding social activities, changes in sleeping and eating habits, substance abuse, or thoughts of suicide. As you can see, suffering from a mental illness is hard enough, but overcoming the misconceptions about your disease can be even harder.
We've been shamed, we've been put down so much that we blame ourselves. We are the problem.
But as Dr. Bill Fole, a professor of school and clinical psychology at Western Kentucky University, explains,
blaming somebody for a mental illness is a way to push them further into the problem rather than getting them to seek help.
He went on to say that seeking help is often the hardest step toward recovery for 2 reasons: fear and ignorance.
People are afraid of the unknown. They're afraid that they have something that's, 1, not treatable, which is not probably true, and 2, that it's always lived in the culture that you don't need treatment for these, you just need to get over it. So you put those together, it's a pretty powerful message.
But there is hope.
The woman you met at the beginning of this story is proof that you can recover from mental illness. Vicki Patterson is now a peer specialist here at the Wellness Center of Bowling Green, where she's able to share her story in hopes of helping others.
My biggest goal has been to give back. I don't want to see young people going through the mental illness and it take them to 55 years old to come out of it.
Because life after mental illness,
it's a freedom. You're in a prison with mental illness. Your mind is in a prison, just as much as if I was in the jail. I was in a prison. I am free. I am free to be who I'm going to be.
The first step toward recovery is a simple trip to your doctor, who can prescribe medication to cope with your symptoms or refer you to a specialist. Here in South Central Kentucky, we're fortunate to have a wealth of resources like Life Skills, our local NAMI chapter, and the Wellness Connection in Bowling Green, which offers free services for those in need.